Good afternoon, almost afternoon. So I'm going to talk to you about the Medicare Advantage prescription drug plan that's offered to the LGHIB retirees that are over 65. It's with United Healthcare. We have a national network, so national means everywhere in the U.S. They don't need to live in Alabama to be part of this plan or access the network. They can move wherever they want as long as it's U.S. and U.S. territory. They also could go in and out of network, so the provider does not necessarily need to be contracted with United Healthcare. They just have to accept Medicare. And just one thing I wanted to also mention, for 2022, we are a 5-star Medicare Advantage plan, and we were just awarded 5-star for 2023. So this is a wonderful honor for us. So I'm going to quickly just speak about who's eligible for Medicare. And those that are 65 or older, or have a qualifying disability can be on Medicare. And they have to reside in the U.S. for more than 5 years. If they or their spouse have contributed to payroll taxes to Medicare throughout their working life, they're eligible for Medicare when they reach age 65, regardless of income and health status. So there's no pre-existing for group Medicare or Medicare in general. So there's several parts of Medicare. Part 1, or step 1, is once the person turns 65, they get their Medicare Part A. They also then enroll in Part B. And in order to be in a Medicare Advantage plan, you have to enroll in Part B. So A is the hospitals, and then B is the providers, the doctors. Then step 2, the retiree has an option. So do they go outside individually and get a supplemental plan, or do they and also enroll in Part D, or do they just make it easier for themselves and just stay on the LGHIB Medicare Advantage plan, where we combine A, B, and D together, and that equals C. That's what Medicare says. So we'll go over some of the plan benefits. So as mentioned, benefits of Part A, the Medicare Advantage plan that we offer includes the A, which is the hospital, skilled nursing, and home health. The B is the doctor's visit, any outpatient, screening and shots and lab tests. And it also includes the prescription drug plan. There's additional programs that we also include that they will not find anywhere else outside. And this Medicare Advantage plan is specific and unique to the LGHIB retirees. Sorry that something is overwriting it. So they could visit any provider, as I mentioned, any hospitals, as long as they take Medicare. Their copay will be the same whether they go in-network or out-of-network, and I have some slides I will show you. Here, it shows you the retiree UHC website and also the phone number. If you came by my booth, I did include in the white bag this plan guide. Behind the plan guide is that website and also the phone number. So if you or your retiree has questions, you can either go to the website or you could call member services, and they could help you answer any questions you have about the plan itself or any of the programs. So we'll begin going over the benefits real quick. The annual deductible is $0 for the plan, and the max out of pocket is $6,700. As mentioned, the copays in and out of network are exactly the same. They do not change. So for PCP, as you see, it's $20, specialist at $30, urgent care at $30, emergency room is $80. Hospital inpatient is $200 copay per day for day 1, $50 copay for days 2 to 5, and then $0 after that. Outpatients, $100 copay, and then we also have virtual visits, and we do have services through Teladoc, Amwell, and Doctors on Demand, and that's at a $0 copay. Preventive services are also included, so that's their annual physical. They do get an annual wellness visit that they could have in combination with their annual physical. We do incentivize the retirees by sending them a gift card when they get their annual wellness visit. They do not have to wait a full 12 months in order to do that. If they got their physical and annual wellness visit in July, let's say, of this year, and they want to do it in January, they are more than welcome to do that. We also do immunizations that are covered as preventive, breast cancer screening, and colon cancer screenings. Additional benefits, Medicare covered podiatry, you see this $30 copay, and Medicare covered chiropractic care at $20 copay. There is routine vision services at $20 copay and routine hearing services at $20 copay. There are some Medicare covered vision and hearing that are also part of the benefits. Now, one of the important things for a retiree is they know a lot about this donut hole. So this plan does not have a donut hole, and it does not have a gap in coverage for prescriptions. They will always continue to pay a copay. It doesn't matter. Once they reach the catastrophic phase, then they actually will pay less than what the set copays are for their prescription. So there is no gap in coverage for prescription here, and that is a big benefit when you have a Medicare Advantage plan. So prescription drug plans, tier 1, it's a $10 copay, and if they do the 90-day, it's $20. For tiers 2, 3, and 4, there is a 20% coinsurance after the deductible has been met. There is a $100 deductible that's only paid once, and then it's a coinsurance after that for both the 30 and the 90 days. We do supply some diabetics testing and monitoring supplies at zero copay for the diabetics. Our monitors are OneTouch and Accu-Check. We do provide the Lancing device, the glucose control solution, and replacement batteries for the meters. Common vaccines that are covered are flu, pneumococcal, hepatitis, the COVID vaccines that are covered under the Part B section of the Medicare Advantage plan. And then under Part D, they will get their shingles, tetanus, hepatitis A, and hepatitis B. As mentioned, they are able to get their annual physical and their annual wellness at zero copay, and we do incentivize them for doing their annual wellness visit. We do have house calls, and that is an in-home visit by a nurse that they will come and review their medications. They will ask them questions, just general health questions, and they will give them a summary of the visit, and that will be sent over to the PCP. The retiree will also get a copy of that summary. We do also incentivize retirees for having these in-home visits. We encourage that, and we do send them a gift card for doing so. We do have the incentive programs that I've been speaking about. It's called Renew Rewards. So if they do certain actions like the annual wellness visit, they get incentivized. If they do a checklist, they get incentivized for that. So there is incentives for the retirees to monitor their health, to keep up with their health, and do what their annual visits are to do. So our program now, it's called Renew Active. We have actually more gyms in our network, in our gym membership, and we also have premier gyms. So premier gyms are like the Orange Theories, the Cycle Bar, the Club Pilates. Those gyms are also included in our Renew Active. And Renew Active is that free gym membership that retirees get. So just like Silver Sneakers, but our program is called Renew Active. As mentioned, they could do the virtual visit anywhere, and it's the FaceTime on their phone. If they're not feeling well, sore throat, as Teladoc did explain, they also have access to that. We also have mental and behavioral health for them. We have a program with Able2, and then other health supports that's through our Optum behavioral health programs. We have the 24/7 nurse support. So in the back of their ID cards, they have a number for a nurse. So let's say In the middle of the night, because that's when we don't feel well, we call the nurse and we ask the nurse, I have this pain and you're not sure if you should go to the emergency room or not. Then the nurse, you'll have a consultation. They will have a consultation with that nurse, and the nurse will provide their suggestion at that time. But if it's an emergency, obviously they go to the emergency room. But they do have that support. There is also hearing that's covered. They do get the hearing tests done, screening done. They also get $500 allowance every 3 years for hearing aids. That's included. And that would be through United Healthcare Hearing. And they handle all of the transaction for them. They look for a provider for them if they don't have one. They submit the claim for them, and they will set up their visits with the providers. If the retiree decides they just want to do their in-home visit fitting for the hearings, that's possible also. Healthy at Home is our program for those that have been discharged from a hospital or skilled nursing facility. They are entitled to 28 meals, mom meals, and they're specific to that retiree's diet. So if the retiree is diabetic, the meals will be diabetic friendly. They also get 12 one-way medically related transportation. So they have a doctor's appointment, they have a pharmacy pickup they have to do. We do 12 one-ways or 6 two-ways. So we got to bring them back home. They also get a 6 hours in-home personal care. So if they need assistance in bathing or preparing meals, we could also offer that. One program that's being very well received is our personal emergency response system. And this is a fall detection program. The retiree would get a pendant they wear around their neck or on their necklace, or a bracelet. It's waterproof, so they could still go swimming in their pools like they like to. And it's in-home monitoring. It's 24 hours. It's free. Anyone that's enrolled in the Medicare Advantage plan, they could sign up to receive this at no cost, and there is no monthly monitoring cost. The retiree will just have to live in a AT&T Wi-Fi area. It's not connected to their cell phone or their cell phone service. No, it's just the area has to have AT&T, and I think we're moving also to Verizon, or they have a landline. And there's 6 different device options that will fit that retiree. So when the retiree calls, they'll be asked a few questions, then they get sent the devices. The retiree could set it up on their own with the instructions that are sent, or they could call back Lifeline and they will guide them step by step in order to install it. We have the Rally Coach program. So if there is a retiree that wants to lose weight, we have the Real Appeal program. If there's a retiree that's maybe on the verge of becoming diabetic, he's pre-diabetic, we have the Real Appeal pre-diabetic program, which is certified by the CDC, that they could join. We also assign a wellness coach as part of the weight loss program for them. And we also offer the Quit for Life, which is a tobacco cessation program if they decide they want to stop smoking. There's also the discount program. They could go to this lifemart.com website where they could view different discounts for traveling or shopping that's available to them. All of the programs that I have just mentioned are included in the Medicare Advantage plan for the local government retirees over 65. They're at no cost to the retirees. And that is all I have for today. If you have any questions, please come and see me. If you haven't seen me, please come and see me. I have information for you, and thank you for having me.